So this video is for after you've done some learning of the somatosensory pathways, and so this is in order to have an approach to go actually from the symptoms back to where the lesion might be, instead of going from the lesion to the symptoms, which I think it's easier to first learn it from lesion to symptoms, but now if you've already learned that a little bit, then we can start to work backwards. This is what you actually have to do as a physician. So we're going to talk about what happens if the symptom is loss of pain and temperature on the left side of the body. Okay, so the first thing that I want to do is make myself a little cheat sheet. Okay, so I'm going to say pain and temperature. What is the major tract associated with that? I hear pain, so I'm going to start to think spinal. So hopefully you think of the major tract as the lateral spinothalamic tract. I remember that if it were fine discrimination touch, fine touch, it would be the medial lemniscus. Okay, so if it were non-conscious proprioception, right, non-conscious, then it would be a cerebellar one, right? So that would be the dorsal spinal cerebellar. Spinal or spinocerebellar. Okay, so I also didn't hear, this is all body information, but what if it were head and face? Then I would hear the word trigeminal, right? Trigeminal, so that's face. Okay, so now let me go back to my problem. So it's body, so it's not going to be trigeminal. Okay, it's pain and temperature, and there's no effect on fine discrimination touch. All fine discrimination touch is in tract. So this is not the answer. Okay, so that's not the answer. Okay, and there's no loss of proprioception, so this is also not the answer. Okay, so now I've narrowed it down to somewhere within the pain and temperature pathway. Okay, somewhere within this whole pathway. This is the major tract name, but is it actually in that tract, or is it somewhere else? Well, one thing we can look at is that I said it was the whole body, okay, so it's not focal. So in theory, you could have a lesion of, for instance, ganglia, right? But what if you had a lesion of dorsal ganglia? You'd also have a loss of fine discrimination touch, right? So now you know it's not in the ganglia. The same thing with VPM, right, the thalamus or the cortex. In those cases, you're not going to have pain and temperature isolated. Okay, so it's not in the cortex, it's not in the thalamus, it's not in the ganglion. Okay, so what about the dorsal horn? Could it be in the dorsal horn? Okay, so remember that you have those free nerve endings, and they come in, they have their first order cell body in the dorsal root ganglion. Okay, and then they come in and they come into the spinal cord. Right, and then they ascend a little bit in Lissauer's tract. Right, some of them will come in here in synapse. They'll send some segments to another level. Right, and then they're going to synapse in that dorsal horn. Right, they're going to synapse on that second order neuron on the dorsal horn. Right, so this is the second order neuron in the pain and temperature pathway within the dorsal horn of the spinal cord. Remember, its axon will cross the midline in the ventral white commissure, and it'll come over to this location, and now it's called the lateral spinal thalamic tract. All right, coming from the spinal cord going to the thalamus, lateral spinal thalamic tract. Okay, so if you had a lesion in this dorsal horn, right, if your lesion was focal, would the symptoms be focal or would they be widespread? And the answer is that the symptoms would be focal, the lesion's focal, right? Because let's say, again, this is a thoracic segment. Let's just say it's T6, okay? So what that means is for lumbar and sacral segments, that information already entered at lower segments, so it's not in there. There's no lumbar or sacral information in the dorsal horn at T6, okay? All that information's already in the lateral spinal thalamic tract over here, okay? So what about cervical, right? So if the lesion were at T6, you also wouldn't affect the upper body. So what that tells you is that this symptom of loss in pain and temperature in the whole body is probably not spinal cord unless you have a very widespread lesion throughout the entire spinal cord. Then you're going to have probably a lot of other symptoms as well. Okay, so it's not spinal cord. That's not the answer. So the most likely answer is going to be in the lateral spinal thalamic tract. Okay, and since the symptoms were in the left body, that means the lesion's going to be on the right side, right? Because the pathways are already crossed. We narrowed it down to lateral spinal thalamic tract. But when you have a lesion of the lateral spinal thalamic tract, it creates deficits that are contralateral to the lesion itself, because you have to follow the pathway back to where you can't feel. This is the left side, this is the right side. The lesion's here on the right side. Where can I no longer feel? Over here on the left side. Got to get all the way back to the receptors. That's the area of skin that has the deficit. Okay, so hopefully this gave you an approach, and we'll do a couple more.